Well, good afternoon, good morning, depending on where you are. My name is Stacey Stewart, and I'm really pleased to see you all, be with you all today. We're going to allow just a few seconds for people to join. We just want to welcome everybody, and we're looking forward to this summit today and a lot of participation and a lot of great engagement with everyone. As for those of you that are joining right now, you're joining because you read the directions and download the app. If you know someone that if you see that someone may not be on, or if they're asking questions, we're putting some information in the chat about downloading the app, because we had several hundred people to register. We just want to make sure everyone has the information on how to access and get into today's summit. So thanks for being on, and again, pass on that information to anyone that still may need it about how to download the app and join us. I'm seeing the numbers increase. Just want to give it a few more minutes, a few more seconds, I should say, not minutes, but again, thanks for joining. Okay, I've got that we're 102, and I'm still seeing the numbers increase, but let's go ahead and get started. Again, my name is Stacey Stewart, President and CEO of the March of Dimes. I wish we could all be together in person. Unfortunately, that's not possible today, but we can still continue the very important work that all of us are working on, which is really the most important thing. And I'm just so thrilled that we're able to gather even virtually for this Mom and Baby Action Network virtual summit. I'm really so pleased that we have an opportunity to learn from each other, to network with each other virtually as we accelerate birth equity. And in this month of Prematurity Awareness Month, and in the week where we have World Prematurity Day, this is a very fitting week to be talking about some of the issues that we're going to talk about today, and especially moving data to action to achieve optimal health for moms and babies. And the first thing that we always start with at the March Dimes, that I know in your work, is with the data. And the data are clear. Moms and babies need us now more than ever. As we face rising rates of maternal morbidity and mortality, premature birth, infant mortality, racial disparities that are longstanding, we have enormous challenges in front of us. And of course, this pandemic has not made things any easier. In fact, it's really exacerbated some of the issues we were already experiencing even pre-pandemic. Just yesterday at the March of Dimes, we released this report card. You all are familiar with this report card, but I really want to encourage you to go to this year's report card, because we've added so many things to it. It used to be, as you all know, pretty traditional preterm birth rates, as you see here, and certain grades by state. This report card really sets the stage for to really present the latest data. And this report card goes even beyond premature birth rates to really include more things around maternal health and some markers that we all can be looking at to really give us an overall sense, not just of premature birth in this country, but really a proxy for maternal and infant health overall. And really ways in which policymakers and practitioners can look at this data and really try to take some action on behalf of our nation's families. The report card shows for the first time in 6 years, we actually saw a slight decline, but you can see it's ever so slight in premature birth rates overall, decreasing from 10.2% to 10.1%. But the grade for the nation, and as you know, we assign a grade for the country. The grade for this country is a C-. And for those of us who have kids in school, we know we're not happy when our kids bring home a C-. And what's really discouraging, I think, is though even with the slight decline, the one thing I guess we can celebrate is we didn't see yet another increase, but certainly seeing the slight decline is not a cause for celebration. And it's primarily not a cause for celebration because what we saw were increasing rates of premature birth for Black and Indigenous women. We know that there are a variety of factors that influence premature birth in this country. I don't need to tell you all that, you know that. You know that an individual's health is closely tied to their socioeconomic status, to the ways in which they live, the stressors, the environment in which they are surrounded in. And so there really isn't one root cause for how we got into this crisis in the first place. There's no one root cause or explanation for what explains this drop, and for Black and Indigenous women, what explains the increase. But even with this this slight decline overall, I mean, this slide really shows where we are so concerned and where we continue to express a lot of concern and want to build awareness. You can see that in certain groups in the country, we have disparities. We see a lot of disparities with respect to Black and American Indian and Alaska Native women, where we have seen basically either an increase or maybe just a slight increase, almost no change, no improvement at all with Black and American Indian and Alaska Native women, and then a slight decrease with White, Hispanic, and Asian Pacific Islander women. Again, we can't fully explain all this. There's more work we need to do to really understand what's happened. We certainly can guess that the pandemic has created enormous challenges for lots of communities, and we know communities of color have borne a disproportionate burden overall with respect to the pandemic. Certainly, there's more work we need to do, and it certainly is true to protect all moms and babies, especially many Black and brown moms and babies. Despite some of the slight improvements in the measures of infant health, though, maternal death and women suffering from severe health complications due to pregnancy continues to rise. And what we're seeing is that the US still remains at a crisis level, especially as compared to other highly industrialized countries with enormously and unacceptably high rates of pregnancy and childbirth-related death, and with persistent disparities, as you see here in this slide. Now, there are a complex web of factors impacting maternal and infant health outcomes, as we've talked about, fueling this health equity gap. These factors, again, are really inclusive of where people live, the environments they live in, the neighborhoods they live in, but also the structural and societal systems that many women face, especially around racism and discrimination, all the issues that we know far too well that are rooted in social injustices, and then really make many communities vulnerable. We know that where you live actually matters a lot. And that's why starting in 2018, and then we updated the report in 2020, we have issued a report called Nowhere to Go to look at this issue of maternity care deserts. A lot of people know about food deserts, but what we've been able to look at are maternity care deserts. So counties in this country where there is really no or very little access to maternity care. About 35% of all of the counties in the country are full-on maternity care deserts. 35% of all counties. Many of them, the majority of them, are in rural areas, but we also have about 1/5 of these counties are in urban areas. But these are communities, these are counties where there literally are no hospitals that offer obstetric services, no OBs, no nurse midwives, no birthing centers. And over half of all these counties either are full-on maternity care deserts or have very limited care. It affects almost 7 million women in total of childbearing age, and about 150,000 babies are actually born to women living in maternity care deserts. So again, when we look at this issue of maternal and infant care, we can look at a lot of different issues: insurance coverage, access to care, social determinants of health. But as you can understand, that this issue is extremely complicated, and it's something that we're all very committed to trying to address. This year in our report card, we added some new sections to really start to highlight some of the areas of focus that we think can be important in terms of addressing the maternal and infant health crisis. For example, we've added sections on midwifery and doula care legislation, and other policy changes that we think can be helpful in terms of improvement with maternal and infant health. This is important because, for example, with midwives and doula care, we know that midwives and doulas can be extraordinarily helpful to improve outcomes for moms and babies, especially moms and babies of color, and especially in areas where there's very limited care to begin with. So you can learn more about these practices, these policies, more about the report card by going to the report card on our website, but also during some of the sessions today, you'll be hearing more about it in roundtable discussions during today's summit. So we'll be sharing more about that. For the Mom and Baby Action Network, part of why we wanted to support this kind of network is because we believe very strongly that at the March of Dimes, we cannot do this work alone, that we go faster and farther when we work together. Access to quality healthcare is just one of the strategies that we're going to focus on today. Other root causes of inequities, such as racism and discrimination, exposure to environmental threats, and economic insecurity, among others, are difficult and complex issues to tackle, but they're ones that we are all committed to trying to address as we move through this work. And so we have to address them. Even though they're hard, we have to talk about them and decide how we're going to address them. So together with our partners at the March of Dimes, we've all committed resources to this work. We've committed to using our influence and our expertise to achieve together what we cannot achieve by ourselves. And in partnership with approximately 600 partners and subject matter experts from around the nation, we've all developed a consensus around a common result that we want to achieve. And that consensus statement is that all people are healthy before, during, and after pregnancy. And if they give birth, they have healthy outcomes. We've activated this Mom and Baby Action Network to mobilize partners from different sectors to invest in and accelerate the implementation of policy, of research, of all kinds of efforts around systems change and funding and programmatic solutions that advance the 5 overarching strategies identified in the National Equity Framework. So if you are not already a member of MBAN, the Mom and Baby Action Network, we hope that you'll join us by going to Igniting Impact Together, that website, which is on the slide here, ignitingimpacttogether.org, and clicking Get Involved. We want to make sure that everyone feels like there's a space and a place for them to be a part of this effort. We want you to feel supported as you work with others to address these really important issues. We're so glad that you're here today. We're just excited to be able to explore together what we can do collectively to move from data to action, to deliberately focus on those upstream factors that impact equity in mom and baby health. We're going to start by taking a look at the Momnibus legislation, followed up, which there's actually action on some of that as we speak, which I'm excited to know. And I'm sure we'll hear about that in just a bit. We'll talk about Momnibus, followed up with concurrent strategy-focused sessions. You'll hear from Policy Links, Dr. Michael McAfee, and how to harness your power for this moment, and wrap up with roundtable discussions and next steps for mobilizing toward action. So we invite you to take full advantage of this virtual platform and the features of it. Again, if you know of anyone that's having problems accessing this app, I think there's supposed to be information in the chat around the app that maybe you could just share with people, remind them, download the app to join us and be with us today. We will have an opportunity to directly connect with each other and engage on message boards with informal roundtable discussions. The whole idea was to make this as interactive as possible so that we could all share and learn from each other. Not that you could just sit on a Zoom for hours, but actually engage with people so it'd be much more productive for all of us. So with that, I just want to say, let's get started and look at how policy action can advance our shared goals. I had an opportunity a few days ago to speak with Representative Lauren Underwood, who excitedly shared her updates on Momnibus legislation. So let's take a listen. Hi, I'm Stacey Stewart, President and CEO of March of Dimes, and it is my pleasure to be here today with our great guest, a woman that I've come to admire, and we so appreciate her leadership in Congress, Congresswoman Lauren Underwood. She is our distinguished guest today, and she's going to be here just to talk for a little bit about our nation's maternal and infant health crisis. As many of you all know, she's also co-chair of the Black Maternal Health Caucus, which is all about advancing the Black Maternal Health Momnibus Act of 2021 to address our maternal and infant health crisis. And she's going to talk a lot about her work there and about Momnibus. But we're just so pleased to have her with us today. So welcome, Congresswoman Underwood. Great to see you.
Hi, Stacy. Thank you so much. I'm so glad to be with you. I'm Lauren Underwood. I have the honor of representing Illinois' 14th Congressional District, and I'm the co-founder and co-chair of the Black Maternal Health Caucus. I'm excited to be joining you for the Mom and Baby Action Network Summit for this important conversation about the Momnibus. And I'd like to begin by thanking you, Stacy, for hosting this discussion and for your tireless leadership at the March of Dimes. You and your team have been such extraordinary partners in our efforts to pass legislation that we know our nation's moms and babies need and deserve. And thank you for all the work that you've done to advocate for this priority and get the Momnibus to President Biden's desk. And to all the maternal and infant health champions who've been gathered together for the summit, thank you for the work that you're doing on behalf of mothers and babies and families all across the country. We know that the work that we're doing right now is more important than ever. Over the past year and a half, COVID-19 has exacerbated risks for pregnant people and laid bare the stark inequities facing communities of color in our country. Data from the Centers for Disease Control and Prevention have found that pregnant people with COVID-19 are at an increased risk for severe illness from the coronavirus, and they might be at increased risk for adverse birth outcomes as well. We've also seen far higher rates of severe illness and death from COVID among Black, Hispanic, Asian, and Native American families. And so these trends are really layering onto the maternal health crisis that has long existed in our nation. We have the highest pregnancy-related mortality ratio of any high-income country, and rates for Black and Native Americans are 2 to 4 times higher than white Americans. And this reality is alarming, obviously. It's unacceptable, but it's also preventable. And so to protect the moms and babies and to promote health equity during this pandemic and beyond, we need to implement comprehensive, data-driven, evidence-based policies that really center the voices of families impacted by this crisis. And that is why I am so proud to be the lead sponsor of the Black Maternal Health Momnibus Act, which I introduced with Senator Cory Booker and now more than 190 co-sponsors in the House and in the Senate. So the Momnibus is a suite of 12 bills that include bipartisan policies to save moms' lives, end racial and ethnic disparities in maternal health outcomes, and promote true equity and justice for all. The Momnibus includes investments to grow and diversify the perinatal workforce, to address social determinants of health, to improve data collection, to provide funding for community-based organizations, and to support moms with mental health conditions and substance use disorders. I really see these as necessary investments that will save lives and support families. And I am so excited to share with you today that we are now closer than ever to getting these investments signed into law. So the Build Back Better Act legislation that has advanced in the House of Representatives includes every single eligible provision of the Momnibus, as well as an expansion a permanent expansion of year-long Medicaid coverage, postpartum Medicaid coverage in every state. We are so close to getting these critical investments across the finish line. We are so close to ensuring that everyone has access to the safe, respectful, culturally appropriate maternity care and robust social support that they need and deserve during pregnancy, throughout labor and delivery, and for the full year-long postpartum period and beyond. And listen, I'm excited to be back together again in person soon so that we can celebrate, because these investments are going to be signed into law and I am pumped. So thank you for your commitment to these issues and thank you for the opportunity to be with you today. And I'm looking forward to the conversation with you, Stacy.
Yeah, absolutely. And it is so exciting and we're making so much progress. And I want to thank you because I've now had one-on-one conversations with more members of Congress over Momnibus than I've had in my entire career at March of Dimes. So thank you for that. It's both Republicans and Democrats. It's been really very interesting. And we've certainly been working really hard to work alongside you and so many others to get more and more co-sponsors, more and more supporters of Momnibus. And let's just talk about that a little bit. I know when I talk to people about Momnibus, they think it's some kind of word that they've never heard before. Sure. So talk a little bit about, you described a little bit about Momnibus. Why was it important to have the package of bills that have been put together? Why was it important to have a package of bills? Why is it important to frame it under Momnibus? Like, how did that even all come about? And what does it mean to have a package of bills to address the maternal and infant health crisis? Why is that even needed?
Yes. So I'm 35 years old. For my entire life, we've had this disparity, but we've not seen federal action to save moms' lives. And so when we think about it, these are solutions that, I mean, these are problems that have a solution and it's evidence-based. And so when we decided, Congresswoman Alma Adams and I decided to found the Black Maternal Health Caucus, we made an announcement. And we thought, we thought people would care, but we didn't know it was going to turn into a thing. It turned into this huge moment. And we started receiving an outpouring of interest and feedback from all types of advocates, experts like the March of Dimes, but also clinicians and industry leaders. We had community leaders across the country really reaching out, wanting to help, wanting to share their findings. And so we set up a stakeholder summit in the summer 2019. And we had like 35 people come and testify, sharing their policy solutions. And out of that summit, we identified, about 10 or so key areas that no bill in Congress had even been proposed to address to solve the problem. We didn't want to be duplicative. So for example, Congresswoman Robin Kelly has long been a leader in the Congress of advocating for permanent full year-long postpartum Medicaid coverage. That is essential to saving moms' lives in this country. We are fully supportive of that policy. I'm so excited that's in the Build Back Better Act, but we didn't want to be duplicative by putting that into the Momnibus. We wanted the Momnibus to be a comprehensive solution to fill the gaps in existing federal legislation. So let's talk about the word Momnibus. Mom, obviously, that's given, but this word omnibus is very much of a congressional word to talk about several bills that come together in one package. So it's one package of bills related to moms. And it's a play on words, but I think it intuitively makes sense. We have an opportunity to save lives, to really correct longstanding harms that have been done and chart a path forward for clinical care, social determinants of health, and really a societal investment in moms and families in this country. And we can do it in a bipartisan way through this legislation.
Yeah, and I think a lot of people are just beginning to better understand that we didn't get into this crisis because of one issue or one challenge.
Exactly.
And so as a result, to get out of the crisis, we have to have a more comprehensive approach. That's why so many different bills to address different aspects of the crisis are really important and needed. So thank you for covering that. I want to go back to something you mentioned, which is really, really important. And that's the extension of 12 months postpartum, which as you just mentioned and explained so well, is not formally a part of Momnibus, but it very much is in the spirit of it, was actually an effort that was already going. And then Momnibus came as a complement to it. But help people understand a little bit about why 12 months postpartum coverage for Medicaid is such an important aspect of what we need to address the maternal health crisis that we face.
Yes. So when we talk about maternal health in this country, the Medicaid program is so essential. In the United States, the Medicaid program pays for half of all births, half of all deliveries in this country. But when we talk about African Americans, the Medicaid program pays for 2/3, 66%. And for those states that did not expand Medicaid under the Affordable Care Act, Medicaid coverage cuts off 60 days postpartum. So that means that the baby has coverage and mom's coverage drops off. Now that's important for this discussion because when we look at the way that we're losing moms, maternal mortality, or even severe morbidity, right? Those near-death experiences, we are seeing that between 1/4 and 1/3 of maternal deaths are occurring in what we call the extended postpartum period. So 60 days, really 6 weeks to the full year after delivery. Okay, imagine that 1 in 4 moms dying and they don't have healthcare coverage potentially. And so the Medicaid postpartum year-long expansion is huge. Now, in the American Rescue Plan that President Biden signed into law this spring, we had an option for states to be able to take advantage of. And I just have to brag on my state and Congresswoman Kelly's state, Illinois, which was the first state to get our year-long postpartum Medicaid expansion approved. But what we are doing in the Build Back Better Act is we are making it, one, mandatory, that all states have to do this. And two, making this permanent. So for the duration of the Medicaid program, this will be a standard benefit. We are going to save lives unequivocally by expanding coverage in this way. And I'm just excited to be able to see this through because it'll make such a difference.
Yeah, and congratulations on Illinois being the leader. And we should also take this opportunity to recognize New Jersey, which became the second state, I think, last week to extend Medicaid postpartum. But again, to your point, why should states be doing this at their option? This should be just an ongoing part of the Medicaid program.
That's right.
And especially as important as it is to birthing children in this country, which is so important. So let's talk about Build Back Better. I have a hard time saying that. And by the time I think we should fully admit that we're doing this a little bit in advance of the summit. So by the time we finish this session, by the time tomorrow comes, where Build Back Better and where the act will be is, it may completely change over the next.
That's the beauty of congressional negotiations. We keep everybody on their toes.
Right. So right now, it's all these things are in the act. Tell us what's your sense of where things are today? What's your sense of, where this is going to go? And are we, how hopeful should we be about all the elements of Momnibus remaining in the act, even as it moves to hopeful final passage and signing by the president?
Yes. So Stacy, I'm so excited about the Build Back Better Act. Democrats are united in our efforts to get this legislation done across the finish line and signed into law as quickly as possible. This is the comprehensive legislation that's going to lower out-of-pocket costs, cut taxes, right, support families all across our country, create jobs, and it's paid for, right, by making corporations and the wealthiest among us, requiring them to pay their fair share of taxes. Within this bill is every single eligible provision of the Momnibus and the mandatory permanent year-long expansion of Medicaid. The good news is that these policies are very popular. And when I say very popular, I'm not hyperbolizing, right? There's provisions in the Momnibus that are bipartisan. The optional postpartum Medicaid expansion passed the House unanimously, or with significant bipartisan support, I should say it like that, in the 116th Congress, and obviously has been signed into law and it's been well received. The political side of this is very clear. These policies are winners across the country. And so I am very confident, we are in very close touch with our Senate colleagues. Cory Booker is the lead sponsor in the Senate for the Momnibus. He has been a tremendous partner and he's a straight shooter, right? Like he keeps it real and I appreciate that. But then, we have individual lead sponsors for each provision in the Senate as well. So there's a diverse array of senators from across the country who have skin in the game, who are truly invested in seeing these provisions get enacted into law. And we have a commitment from the White House. Listen, when Vice President Harris was in the Senate, she was the lead sponsor for the Momnibus. That commitment has only continued and grown as she has assumed the role of Vice President in the United States. And then obviously President Biden has been such a fierce champion for maternal health. I am feeling very good. I mean, listen, if March of Dimes supporters want to call their senators and, reiterate how critical these maternal health investments are to remain in full in the Build Back Better Act, we would welcome it. I mean, I would never dissuade anybody from reaching out to their elected official. But I think that, as we look ahead towards the end of the year and, the timeline that we have to get this thing enacted, I think that we'll all be very excited in the final Build Back Better draft.
And it sounds like what you would say is that now is the time to do that, right? Now is the time while we're in the midst of the Build Back Better Act being considered and hoping to get it all done, that this is now the time to weigh in with members of Congress to let them know how much we support all of these pieces of legislation and the entire Momnibus Act, including extending 12 months, Medicaid 12 months postpartum for sure.
Yes, but especially the Senate.
Yes.
Just because of the timeline. I think the House will have taken action by the time people see this.
So really, the Senate is where we need to put our attention and our focus. Yes, as always, right? As always. Well, listen, I think we're just about out of time, and this is great. Do you have any other parting thoughts to the members of the summit about their work and how important their work is, and anything more to share about the Black Maternal Health Caucus and where you see the next steps going?
Well, Stacey, I'm excited. I am grateful that we get to partner with you and your members across the country. And I think that, this is going to be a really affirmative step to say that the advocacy that we've been engaging in for many years, many decades works. We're in a moment where, lawmakers in Washington understand the return on investment that we see for investing in maternal health, right? We not only can end disparities and achieve true birth equity for everyone, but we can also improve the quality of care. We are investing in this workforce, which makes huge gains in every community in this country. And so I think that we are really changing the nature of the conversation around maternal and infant health. And we're already starting to think about Momnibus too. I mean, I'm not trying to break any news here, but if y'all have some suggestions, let us know, because there's a lot of maternal health issues that may not be as directly contributing to maternal death, right, maternal mortality, but certainly have gone without resources or investments for a long time. Talking about things like endometriosis and fibroids and some of the challenges that we're seeing, even with fertility treatments, the lingering issues with pregnant people and violence, right, domestic violence. I mean, we have a tremendous opportunity to make some key investments and save lives. And so, the work continues.
Yeah, absolutely. And I'll put in a little plug for something called paid family leave, which I think is really important. And I think every mom and every family definitely appreciates that. Well, listen, we're out of time. This has been really wonderful. And it's so great to see you. Thank you for all of what you do, your leadership, Congresswoman Alma Adams, Congresswoman Robin Kelly. I mean, so many champions, sheroes who are just amazing. And we're just honored to be able to work alongside you. And again, as Congresswoman Underwood said, if you would like to, as a member of this summit, when you go back home and you talk to all of your colleagues, please, 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 the March Dimes makes this really easy. I just sent a text to my senator asking them to support Momnibus, and I use the March Dimes' platform to do that. Really easy to do. And it's a way for us to come together and really have a strong force and voice and push to make sure that the Senate, especially Congress in total, and the president all know how much we care about these issues. So thank you, Congresswoman Underwood, so much. Thank you to all the summit participants for being a part of this. Again, go to marchdimes.org and our action center to take action and make sure your voice is heard in support of Momnibus. And so thank you so much. And Congresswoman Underwood, thanks for your time today.
Thank you.
Well, good afternoon, and thank you, Congresswoman Underwood and Stacy, for that motivational interview. And as you heard moments ago, this is an exciting time for maternal and infant health advocates. The Build Back Better Act contains a down payment on one of the 9 Black Maternal Health Momnibus Act component bills, which would extend 12 months of postpartum coverage under Medicaid for eligible, pregnant, and postpartum mothers. This will be the largest expansion and investment in maternal health equity in America's history. Separately, the Protecting Moms Served Act, also part of the Momnibus Act, is on its way to being passed and signed into law. And so I've seen in the chat, there's been many questions about the Momnibus, and we've got a member of Congresswoman Underwood's team, Jack Demento, who's going to join us and answer some of the questions. So some of the questions we've been seeing posted, you'll hear your answers here. It's my pleasure to introduce Jack. Jack is the legislative assistant to the office of Congresswoman Lauren Underwood, where he covers the Congresswoman's work on health, policy issues, including the Black Maternal Health Caucus. Jack has started in Congresswoman Underwood's office. He's been a member of her team since 2019, and currently he started as a health policy fellow in her office and has moved his way up throughout the ranks. Jack, thank you for joining us. It's great to see you. So let's get started with some of the questions we have on the Momnibus. First, as we've heard, and I know today the Momnibus bill is on the House floor. It is expected to pass and hopefully go straight over to the president's desk. Can you give us, for his signature, can you give us a little bit more intel in terms of what are your predictions about it being passed in its entirety and being fully funded?
Sure. Thanks, Stacy. And thank you all so much for the opportunity to be with you. I hope you can hear me all right. We're in the office today. We're voting on the House floor. And as Stacy mentioned, it's a really exciting day for the Congresswoman and for the Black Maternal Health Caucus, because the first of the 12 bills in the Momnibus is going to be fully passed out of Congress and on its way to President Biden's desk to be signed into law. That's the Protecting Moms Who Served Act, which is the Momnibus bill that focuses specifically on maternal mortality, morbidity, and disparities among veterans. We know that our veterans have some unique risk factors that can put them disproportionately at risk for adverse maternal health outcomes. That could be something like military sexual trauma, which is linked with risk factors for adverse maternal health outcomes. And so it's really important to make investments in the Department of Veterans Affairs maternal health programs. And that's one thing that the bill would do. The other thing the bill would do is commission the first ever comprehensive study of maternal mortality and morbidity among veterans. This bill has already passed the House with unanimous bipartisan support. It passed the Senate with unanimous bipartisan support, but they made some slight little amendments to it over in the Senate. So we have to pass it again in the House. That's what we're doing today. Actually, just moments ago, it was debated on the floor. A recorded vote was requested. So fingers crossed, within the next couple of hours, that bill will be passed and on its way to the White House for President Biden to sign into law. So the Congressman is really excited about that. The Black Maternal Health Caucus is really excited about that. And then hopefully that's just the first of many Momnibus bills to be enacted here in the coming weeks. As the Congressman was discussing with Stacey Stewart, almost all of the other bills in the Momnibus, every single eligible provision of the Momnibus is included in the Build Back Better Act. So, I think the hope was that the Congressman and Stacey Stewart would have their conversation. I'd come in today and tell you that we've already passed it in the House and it's on its way to the Senate. We're not quite there, hoping to vote this week in the House on the Build Back Better Act, which would include those Momnibus provisions. But as the Congresswoman said, and as Stacey Stewart said, now is really the time for people to be engaging and expressing their support for these critically important investments. And hopefully we'll see them on their way to the president's desk soon as well.
So thanks, Jack, for the update. And we're crossing our fingers that it makes it to the president's desk and we wrap it up the day on the floor. Here's one or two other questions I have for you. So one is, does the full year of postpartum coverage mean that women can receive coverage for case management and home visits?
Yeah, it's a great question. So one of the really critically important provisions of the year-long postpartum coverage investments in Build Back Better is that it's year-long postpartum coverage with full state plan benefits. So the alternative would be, there was some people wondering, well, would you just be covering specifically pregnancy-related services? And that's not the case. This covers all of the full state plan benefits. Now, as you might know, the Medicaid program varies state by state. So what's covered by Medicaid in one state might be different than what's covered in another state. But those full state plan benefits in every state will be included for the year-long postpartum period, as opposed to just 60 days postpartum, if we're able to get this passed and signed into law.
So I've got two additional questions for you. Well, actually three, Jack. Are there some strategies for ensuring the postpartum mom gets in to see their doctor at critical points during the postpartum period?
Sure. Well, I think first off, and this kind of goes to the postpartum coverage piece, if that person doesn't have health coverage to begin with, they're not going to be able to go. And so it's really critical that we have coverage for that year-long postpartum period. And what we have included in the Build Back Better Act will ensure that no matter what state you live in, you have that year-long postpartum coverage, as opposed to coverage that cuts off just 60 days after the end of a pregnancy. So I think that's the first piece. The second piece, and this is covered as well in the Build Back Better Act, we know that doulas and other birth companions, peer supporters, navigators can play a really critical role for pregnant people, both during their pregnancy and after their pregnancy, and can ensure that new parents are able to get in and keep up with their appointments for themselves and their babies. And the Momnibus includes a title called the Perinatal Workforce Act that makes robust investments in growing and diversifying the perinatal workforce, both on the clinical side, so thinking of our midwives, our nurses, our physicians, our maternal mental and behavioral health professionals, and then also doulas, peer supporters, others who are working with that pregnant person all throughout the perinatal period. And those provisions were included in the Build Back Better Act as well. $295 million in the Build Back Better Act to grow and diversify the perinatal workforce. And we really think that's a critical element of making sure that new parents are able to get that care that they need all throughout the perinatal period.
So Jack, here's another question that we have that came in. And the question is, and I think it'll be helpful for you to answer this, and I'm excited because I think I know the answer, but it is, how do individuals determine if their representative and senators have signed on to the bill? So that's the first part of the question. And then the follow-up to that is, if we're able to share that, and everyone who's joined us today, take and find out exactly who your senator is and who your representative is, that's the way that you can help us advocate for the change, for the votes we need to take place on Congress. So Jack, can you answer how they find this out?
Sure, that information is publicly available, and I don't have the link in front of me right now. Maybe if someone has it, they can drop it in the chat, but there's a website called congress.gov. It lists every single bill and who all the co-sponsors are for that bill. So the Momnibus has a bill number in the House and a bill number in the Senate. The House bill is led by Congresswoman Underwood. It's HR 959. So if you go to congress.gov, you search for bill number 959, you'll find a list of the co-sponsors. I think we're up to 164 co-sponsors in the House as of today, and another 29 in the Senate. The Senate bill is S346, led by Senator Cory Booker. So between Senator Booker himself, as well as the 29 co-sponsors, that's 30 of the 50 Democratic senators who are co-sponsors. You can find the full list on congress.gov. And that's updated on a daily basis. So you can check that to see if your member is a co-sponsor. If they are, you can thank them for their support and ask them to keep pushing for these investments to be in the Build Back Better Act. And if they're not, you can engage with them to become co-sponsors. The final piece I'll say on that, the Momnibus, like the Congresswoman said, has 12 bills in it. Those bills were also introduced as standalone legislation. And so, we know that some people have Republican representatives or Republican senators who might not be jumping to co-sponsor the full Momnibus, but there are individual bills within the Momnibus that have really strong bipartisan support, and we'd love to have their support as co-sponsors of those bills as well. Of course, hope you can bring them along to become co-sponsors of the Momnibus. We know that we can't solve this crisis without a comprehensive approach, which is what the Momnibus includes. But co-sponsoring bills like the Moms Matter Act, which focuses on maternal mental health, the Protecting Moms Who Served Act, which again is passing the House today with strong bipartisan support, we hope. The Tech to Save Moms Act, which is a bipartisan bill. So these individual components have strong bipartisan support. And if your members are Republicans or Democrats, there's still room for them to get on board and to help push this priority forward.
Thanks, Jack. And I will tell you, Casey did place in the chat the link for how you're able to locate who your congressional member is or who your state senator is. So again, give it, as Jack has stated, reach out to them, thank them if they've been supportive. And if they haven't been supportive, please, we ask you and encourage you to be advocates and reach out and encourage them to please support the legislation and become co-sponsors. So Jack, we've got a few more questions. So people are truly excited about all the work and what's happening with the Momnibus. Is there an emphasis on breastfeeding support and lactation support covered under this coverage?
Yeah, so that's included in a lot of these really critical workforce components. We just know that we have to grow and diversify that workforce. Another piece that I'd like to mention that is actually not directly in the Momnibus, but is in the Build Back Better Act, which has really been championed by Vice President Harris, among others, is a Medicaid demonstration project to invest in maternal health homes through Medicaid, really trying to provide coordinated maternity care and thinking about the maternal health care team really expansively, including some of that critical lactation support. It's really, I think, a significant step that that's included under Medicaid, these maternal health homes, because it's one thing to have funding for a grant program. We don't know if that funding is going to be there permanently, but if you can get something entrenched into the Medicaid program, it's there permanently. So this could be a really unique opportunity to think more expansively about what maternal health care and support means, that it's not just the care that you receive in that immediate labor and delivery period, but it's the prenatal period, it's the postpartum period, and it's inclusive of some of that really critical lactation support that we know is critical for both parents and babies in that postpartum period.
And so Jack, there was a question that came in, and it was specifically to maternal health during pregnancy, in addition to postpartum mental health. And I think you answered it a little earlier, but if you could just answer, will there be maternal mental health coverage as well as a part of the 12-month Medicaid expansion?
Yeah, absolutely. It's that, again, part of the full state plan benefits. And also, one of the bills in the Momnibus is the Moms Matter Act. It's one of the bipartisan bills led by Congresswoman Lisa Blunt Rochester and Congressman John Katko. The Moms Matter Act kind of has two separate sections. One of them is a maternal mental health equity grant program to really invest in community-based initiatives to address maternal mental health conditions. A lot of people talk about postpartum depression, that's included, but we also know things like substance use disorders, anxiety, conditions that emerge in the prenatal period and the postpartum period, conditions that might be new or worsened related to pregnancy, and really investing in community-based initiatives to promote equity. That's one component of the bill. The other component is growing and diversifying the maternal mental and behavioral health workforce. We know that there are healthcare workforce shortages broadly in this country. We know we see it specifically in maternity care. We see it specifically in mental health care, and we really see it at the nexus of those two pieces of maternal mental health care. So the other component of the Moms Matter Act is investments to grow and diversify the maternal mental and behavioral health workforce. And really exciting, both of those sections are included in full in the Build Back Better Act. So $100 million investment for maternal mental health equity grant programs, as well as the funding for the maternal mental and behavioral health workforce. So again, if we can get this Build Back Better Act passed and signed into law, all of that funding will become available for communities across the country.
So thanks, Jack. So here is an additional question, and it builds off of what you just said. I was hoping that at some point, as we're going through today's program, we'll get some notice and phones will ring and alerts will pop up and tell us that everything's been signed and heading over to the president's desk. One of the questions that came in, especially since we're talking to advocates and partners, which parts of the Momnibus Build Back Better are at risk? And which ones can advocates do? And what can they do at this point to help?
Yeah, it's a great question. So the good news is we haven't heard of any specific provisions that are at risk, and nobody who's expressed opposition to any particular component. The real question is, how do we ensure that these are prioritized? We know that, the original Build Back Better Act in the House, as it was starting to be formulated, we were looking at a package of around $3.5 trillion. That package is looking now closer to, $1.75 trillion. Now, even the smaller overall price tag language includes all of those Momnibus and postpartum investments in full. So we made that initial cut. But as the congressman said, as this moves from the House to the Senate, we really need to ensure that people understand the urgency of these investments. Again, it's a package of close to $2 trillion. These maternal health investments represent just a fraction of a percent of the overall cost. We need to make sure that they don't get lost in the shuffle. People understand the urgency of including them, and the extent to which you can speak up for some of those particular provisions that you find most important, as well as the comprehensive need, is really going to go a long way in ensuring that they make the final package that does get to the president's desk, hopefully in the near future.
Thanks, Jack. So here's a question for you. It is, why did Representative Underwood get interested in climate change and moms' health?
Yeah, that's a great question. So the big reason that kind of motivated putting the specific protecting moms and babies against climate change into the Momnibus was a study that was released last summer, which I think really confirmed something that a lot of communities know and have experienced, which is that air pollution and extreme heat caused and exacerbated by climate change are having disproportionate impacts on Black communities and other communities of color and leading to adverse birth outcomes. This study did a systematic review that included more than 32 million births in the United States and showed how these adverse birth outcomes were associated with people who live in areas with extreme exposure to extreme heat and air pollution. And so the Congresswoman introduced the Protecting Moms and Babies Against Climate Change Act to make investments directly into those communities to ensure that they have resources both to mitigate the risks broadly and then specifically for people who are exposed right now to those risks, ensuring that they have the support they need. So you could imagine, if someone is exposed to extreme heat, ensuring that they have, air conditioning and the ability to pay their electrical bills, direct financial support to meet those needs. And so that study kind of prompted it. But again, we know that research confirmed what people have been experiencing in their lives over the course of the many years that this study was analyzing.
Thanks. So I have a question that is coming in from one of our CLC doula and lactation peer counselors. And what is shared is currently there's no licensing for CLCs to bill directly to insurance in their state. And their state is Connecticut. And that limits their ability to access support for some of the women. Are there any provisions in place that might address that on a national level?
Yeah, so a good question. Usually licensing is a state issue. You could imagine federal legislation to address it. The one thing that I had mentioned earlier is that, when we talk about what from the Momnibus is in the Build Back Better Act, it's every eligible provision. And that's because the Build Back Better Act is advancing through a process called budget reconciliation, which is a Senate side procedural mechanism that includes a lot of different rules. And one of those rules really limits what you can do in terms of creating new policy. You really have to make investments through the reconciliation process. So trying to address that specific issue is not something you could do through reconciliation. So you couldn't do it in the Build Back Better Act. But again, it underscores the need for the growth and diversification of the perinatal workforce, ensuring that no matter where someone lives, they have access to care and support and these services that people and families are depending on. So definitely something that the caucus will be looking to engage on if and when we get the Build Back Better Act passed and signed into law.
So Jay, let me ask you, this question comes from me. What do you think it would take for Congress to make permanent the Momnibus?
Yeah, well, I mean, that's a great question. I think that these investments that we're including in the Build Back Better Act are many magnitudes larger than what the federal government has ever done on this issue and should hopefully meet the needs that we know are out there. But it's not the end. I think the Congresswoman mentioned towards the end of her conversation with Stacey Stewart that we're already thinking about Momnibus 2.0 and how we can continue to make needed investments both in the perinatal period specifically, and then really across the life course to meet the needs of women and families. And so I think that your question really prompts us in the direction that we're hoping to move after the Build Back Better Act, which is how do we make these things permanent? How do we keep addressing the really broad range of issues affecting families?
So, and then here's one additional question for you. Is there any language, it's coming in on our live chat, is there any language in the Momnibus bill that has already expanded, where there are states that have already expanded this through ACA to be able to receive federal matching funds in their state plans for eligibility, for Medicaid eligibility and benefits?
So if I'm understanding the question correctly, 2 states have already expanded their postpartum coverage to 1 year. The Congressman mentioned Illinois was the first. And then New Jersey really recently was the second. And that's huge. It's a life-saving investment in both of those states. But your ability to access care in the postpartum period should not depend on what state you live in. And that's what's so exciting about these postpartum investments in the Build Back Better Act. They'll ensure that that year-long postpartum coverage is available in every single state, not just the ones that have elected to take up an option.
And so, Jack, let me ask this question. It is, what kind of investments would Momnibus make to local communities to improve maternal and infant health?
Yeah, absolutely. So one of the things that Congresswoman Underwood emphasizes frequently is that this is not an issue where nobody knows what to do about it. There have been leaders in communities, and the Congresswoman and the Black Maternal Health Caucus, just at the beginning of this process a couple of years ago when the Momnibus was first being drafted, to just start by listening to community-based organizations, women, Black women in particular, who have been addressing the Black maternal health crisis, other women of color who have been on the ground leading initiatives to save lives and promote equity in communities across the country, and not just listening, but investing in those organizations and in those community-based leaders doing that work. And so the Momnibus includes funding specifically and exclusively for community-based organizations working to promote maternal health equity. And that funding was included in the Build Back Better Act. So if we get that signed into law, there's going to be historic investments coming directly to community-based organizations working on this issue. And I think that's one of the provisions that the Congresswoman is most excited about and that you hear her talk about most frequently.
So, Jack, and this is my final question for you. If advocates who join us live here today want to support the March of Dimes and its congressional allies in ensuring the Build Back Better Act passes and it's signed into law, what can they do? Is there a specific site or social media asset or role that they can play? If you could share that with us, that'd be great.
Absolutely. Well, March of Dimes has some amazing resources. I hope someone will put the link in. They have really fabulous advocacy toolkits. And we hear frequently from offices saying that they've heard from March of Dimes and your advocates across the country through this tool. So thank you for everything that you're doing. I think keeping up that pressure and keeping up that advocacy makes a big difference. You can also follow the Black Maternal Health Caucus on Twitter. We're at BMH Caucus. And that really provides up-to-date information. For example, if the Protecting Moms Who Served Act passes later today, the caucus will be posting about that and making sure everyone knows as soon as it happens. And then just continuing to contact your members of Congress and ensuring they understand why this is such a priority for you and why these investments are so desperately needed will go a really long way in building the support that we need to get the Momnibus enacted through the Build Back Better Act as swiftly as possible.
Jack, thank you so much for your insightful comments. It was great to see you again.
You too.
I know that our listeners found your comments as beneficial and educational as I did. Again, thank you for speaking with us. Thank you all for listening. And when I say thank you to, I got to make sure that I say thank you to you and say thank you to Congresswoman Underwood for just all the hard work you all have been doing, especially with us and especially working closely with us and our allies. And more importantly, her support in launching the Black Maternal Health Caucus and making sure we get this legislation as possible, get to moving. So we're excited. Tell Congresswoman Underwood, we're looking forward to continuing to working with you. And we're definitely, all of us are watching and listening for alerts regarding where we stand with the Momnibus legislation and basically looking at how it's going to improve rural maternal and infant health and promote interventions for healthcare across the country and newborn screenings. And so I hope that all of you who've joined us have found this interesting and informative, and we call you all to definitely sign up to become advocates and look at the code, scan code that's present. We ask that you scan it, become a part of our demand blanket change. And we're sharing the QR code now. Again, if you're looking at the screen, it's a direct link. And we'll also put in a direct link for you to be able to join Demand Blanket Change. And we're going to take a 5-minute break. And thank you all for attending. And we look forward to having you join us in about 5 more minutes.